Hey, everybody. My name is Dr. Noah Moose, and this is,
Natalie.
and we are healthcare practitioners in the Austin area. And one of the things that, we wanted to talk about and kind of like open up discussion on is, the things that we see in our office, the things that people come to see us for. And, one of the things that we get people who have been through all different areas of different healthcares, different challenges, different struggles, and they haven't been able to find the help that they need. So what we wanted to do is take time to just kind of highlight some of the things that we see and how we see them and what happens and how we're able to kind of unwind some of these things that are going on in the body. And one of the big things that we look at is blood work. And blood work can be one of those things that gives us information about the underlying things that are going on in the body. But we have definitely a different way of looking at, the blood and all of that. And so what we wanted to do was kind of like just tap in and give some information about like what that kind of looks like in that area. So
For sure. We really do look at blood work super differently in our office. We really do try to get to the root cause of issues. And there's a lot of things that people come to us for where, yeah, it's almost like a mystery, like they might not have a disease, but they don't feel great. And so we're kind of trying to parse through any form of data that we can collect, right? We love running blood work in our office, hormone tests, stool tests, all different types of testing to look for little clues here and there that might be off that could be affecting your health. So blood is one of our favorite ones.
yeah, and most people have had blood work, right? Like that's one of the things is they've had this blood work, they've had interpretation of it, and especially people who have had like a lot of like chronic or complex health issues. A lot of times they go to the doctor and they're like, this blood work is fine, like there's nothing wrong with them, and they just feel discouraged because they know they don't feel well, they know they have these symptoms, but they're not actually like getting any answers to it. And so one thing that we wanted to touch on initially at first is there's different ways to read blood work, right? Like there's like the traditional way that they read it, which is they're just looking for an overt disease, right? And if that overt disease doesn't exist, right, then they're just like, you're just normal. And so, but what's going on is between the being healthy and like developing a disease, there's like this huge spectrum where people just get lost in.
Absolutely. There's just very different ranges. So I think it actually might be great to kind of talk about like how are lab ranges even established, right?
Yeah.
Yeah.
I think that's like one of the best things to look at is like, I think that most people just assume that there is, like this whole like scientific process to how these like blood values are determined, when really what they do with these is they take basically a standard of, and if you go to like a LabCorp or a Quest or a CPL and you look at, let's take like hemoglobin or glucose, right? Like values that almost every single person has had run, like each lab is going to have a different range, right? Which doesn't quite make sense because if we were basing this off of like a true like science, right? Like there should be a healthy range and an unhealthy range. And that's not to say that there isn't any science behind these values, but what they're doing is they're taking basically a sample of the average like person that comes in there. And if you look at most of the people who are getting blood work, a lot of them are like they're maybe going there because they have an illness, because they have this. So we get these ranges that get skewed a little bit, and then they're basically being like, well, we know X, Y, Z disease happens around this point. And that's where they set the low end or the high end because they know that the disease happens around there, but everything in between, there can be a lot of symptoms in those areas. So
Yeah. And when they're kind of pooling together how to establish these standard lab ranges, they're looking at what maybe they consider like a healthy population, right? Or generally what most people are showing. But when you look at the average American, unfortunately, we're not very healthy. And so we don't quite want to compare ourselves to those results, right? Because there are a lot of people who are running blood work or who are fitting these ranges but don't feel good, right? So we have to kind of rely on different types of information to figure out, well, what does healthy blood work look like, right? And so that's when you start diving through the research papers. And that's where we started to establish our lab ranges, right? We're looking for things where, what's causing all-cause mortality? What are optimal ranges where people can actually achieve health goals? What pushes biochemical physiology in the body? And so looking for those pieces of information, tighten the ranges. And then when we tighten the ranges, we have healthier ranges to compare our bodies to. And I think that's where we like to live because, you know, you might not have a disease, right? But you don't feel good, right? So it's like looking for these subclinical things that are going on. And there's so much we can learn. And actually, there's really fun lab values to look at. And a lot of them might not even be run typically in your, yearly physical. Some of them are, but some of them aren't. And those deserve some attention as well.
Yeah, and I think that's like an important thing to kind of think about is that, when we start to look at like all cause mortality, like and then also like optimal health, like right, like there these ranges. When you start to read research papers and you start to look at things, you start to see that there's this range where it's like above like this number here, you see a greater incidence of like all of these kind of things start to happen, and so it's like, and those are very much inside of the normal range. And so as we start to work on like, getting the body into those like tighter ranges, and that we start to see health start to improve. We start to see a lot of symptoms start to go away. And we're just trying to focus on getting the body healthy and all that. And, for me, I work with a lot of the top level athletes in the world, right? We're talking, Olympic medalists, NFL players, the top people in the world. And one of the things that we look at with this is that when we start to see, one of the things I'm working with all of them is yes, I care about their performance, right? Like, right. But also like, I care about their health. And it's the same thing with like an everyday person that comes in our office that may be struggling with like just maybe some like fatigue, tiredness, or like also might have some like chronic or complex illness, right? We're concerned about the health. And one of the things on the athletic side that I always kind of look at is I tell my athletes, it's like, yes, I care about your performance, but more importantly, I actually care about your health. And if we can get you to be healthier, I know you're going to perform better. And then we don't want to be comparing, like if you're a top level athlete in the world, we don't want you to be comparing your blood values to just the everyday person that's like walking in off of the street, because you're trying to win an Olympic medal. You're trying to, do things that nobody else has done before. We want to make sure that these values are in this very healthy, tight range where we can see the optimal expression of like your true human potential. And that's kind of the way that we look at it is it's like, and that goes with every single person that comes in our office is we're like, we want to try to find those limiters or those anchors that are holding them back from expressing their true health, from being able to do the things they want, being able to, play with your kids, to run that marathon, to do that 5K, to be able to get up out of a wheelchair and walk, right? Like these kind of things that like you need the energy for, you need that. And it's so basic. And I know you mentioned, some of the other values that maybe aren't ran as much, but oftentimes it's just as important to see like, for me, it's like I get like emails or like texts or calls from, coaches from all over, and they have this very limited like data of like, why is this athlete not doing well, right?
Yeah, because I actually think you had a good example recently with one of your athletes was concerned about anemia, and they sent like 2 values over.
Yeah. And so it's kind of interesting is I got a text message from a coach that I've worked with for a long time. And he's like, hey, I got this athlete that's like having some like issues and stuff like that. And I was like, oh yeah, like send the blood work over. Let's see what's on there. And they sent over like iron and ferritin, right? And I was like, and I asked, I was like, is like, do we have like a hemoglobin marker, like a CBC, like anything like that? And they're like, no, we just have like iron and ferritin. And I'm like, oh, well, there's nothing I can do in that like area, because it's like, it's like, yeah, we could like maybe like give some iron or something like that, but it was like just like low end of normal. But then I was like, that might not track with everything else. So it's like, it's like the looking at the values in isolation, right? Like where I think a lot of times like in the endurance athlete world, especially, is like they get really fixated on this like ferritin number. And it's like, if you just correct ferritin or something like that, then you're going to correct this entire myriad of problems, right? But really, like, the magic happens is when you start to look at, like, okay, like, is the hemoglobin low? Okay, the hemoglobin is, functionally low, and the difference in that value is really important. It's actually, I always say, people ask me what my favorite value is, and I always say it's hemoglobin, right? Because that's the determinant of oxygen status in the body, right?
Yeah.
And so then you've also got to look at like when that hemoglobin is low, are the red blood cells too big or too small? Because it's a completely different treatment.
Yeah.
And I mean, you had this exact experience with your athletic career,
Oh,
right?
absolutely. Yeah. So actually, when I was a elite runner, I was doing really well up to a certain point, and then one year, everything changed. I started feeling very ill. I got very sick, and my performances became shaky. I didn't understand what was going on in my body. I'd be like, is it in my head? I was like trying to figure out, like, am I not pushing myself hard enough? And then it really dawned on me, like, no, I am like putting the same effort in. I am pushing through, and yet my body is failing me. And so that's when I started looking for answers. So, of course, first thing, you go to the doctor, right? Oh, let's get a blood panel on you, get blood work run. But all my labs would always come back normal. And I was like, I know something's not right. And it was actually crazy. My biggest manifestation was actually leading up to the 2008 Olympic trials and the national championships. And as I was getting closer, a couple weeks before nationals, I had this excruciating pain in my abdomen that just felt like something exploded inside of me. And the thing is, once again, I ran to the emergency room. I could barely breathe. I could barely speak. It was just so much pain. And they did all these tests on me, and everything came back normal. And I was just like, I feel like I'm going to die right now. Like, how is everything normal? So I was kind of in the dark for a long period of time until after the Olympic trials, they finally found that there was a hematoma on my liver that ruptured. And I was internally bleeding. And it's like, how was that missed, right? And so it wasn't until years later, actually till I met you, where you looked at my blood work and you're like, oh my gosh, this looks terrible. And I was like, what do you mean it looks terrible? Everybody says it looks fine, right? And then he started teaching me, like, well, this blood value, when you look at it in combination with this one and this one, it could mean this. So we need to explore this. And it started making sense to me, right? Because I would have doctors look at things on, like, offhand. They would be like, oh, your immunoglobulins are really low. That's weird. And I'd be like, well, what does that mean? Maybe something with your immune system. I'm like, okay, like what? But there's no, I don't know, there's no investigation. And then maybe even one of my favorite ones, there's a value called MCV, and it basically is kind of the size of your red blood cell. And my red blood cells were huge, right? And I'd ask what that meant, right? They're like, oh, yeah, I mean, your blood cells are just, I don't even think they gave me an answer, to be honest. They're like, we'll just watch it. We'll check back in 6 months or something and look at the sizes of them or whatever. And I found out, yeah, it's the size of your red blood cell. And interestingly enough, your red blood cells need to be a certain size to carry oxygen. And as you can imagine, as an athlete, that's incredibly important for your red blood cells to carry oxygen. And mine were too big to hold oxygen. They weren't maturing. And one thing you need to help those red blood cells mature is vitamin B12, right? That's one of the nutrients. And that turns out to be the one that I was deficient in. And sure enough, I gave myself B12 and my red blood cells started becoming the right size to carry oxygen. And in a sense, it was kind of an anemia, right? Not the classic iron, but it was a different type of anemia, right? That I think is underappreciated, right? Yeah.
And I think anemia, like, one of those things that, like, I think they're like a conversation like that. Then this is what I always tell, like, our patients and things like that when we talk about anemia is it's like, people think anemia, they immediately think iron. But what anemia really is it's the inability to deliver oxygen to your tissues, right? And so I always use the analogy. It's like if somebody's like in this like functionally anemic state where they're not like overtly anemic. And so in my 15 years in practice, right, I've watched the value drop almost a full point from the normal low range, right, to like where it is now. And so like that's a lot, right? Like that's probably like a 10x like change in like in function.
Yeah, it's
and
huge.
so I always tell people it's like, because a lot of people will come in and they'll be fatigued, they'll be tired, they've got like some anxiety, maybe some like depression, like something like that. And they're trying all these things, which are important. Maybe they're going to therapy, maybe they're doing like all these things. But it's like, if you're not getting oxygen to your tissues because of like a subclinical anemia, I always use the analogy of like when you were a little kid and you jumped off the diving board and you went down to the bottom of the pool, right? And you're like swimming back up and you're just like, you're getting there, but you're a little bit low on like oxygen because you're like, you were down at the bottom of the pool and you're coming up and you're little and you don't have as big a lung capacity and you start getting a little panicky, right? Like, you're going to make it to the top of the water, but you kind of like, ooh, I got to swim a little faster because this is like uncomfortable, right? Like, this lack of oxygen in my body is like uncomfortable and I'm not feeling great.
Yeah.
Right. And so then you get up there and you're like, right?
Yeah.
And so that's a lot of what, when you're in these like anemic and sub like anemic states, right? That's almost how your body's functioning at all times, right? Is you're just trying to swim from the bottom of the deep end up and you just feel panicky.
Yeah, it
right?
might not be a full-blown anemia, but it's enough to where you're not utilizing oxygen as best as you can. If you're an athlete, it's going to affect your performance, but even for anybody, if you're not oxygenating your body's not going to be as resistant to infections, right? And actually that was in my case as well. Like, I became less resistant to fighting infection. So oxygen's crazy important in the body, right? For breathing, for your immune system. It does so much. And to just even be a little bit depleted, let's call it like an oxygen deficiency, right? It's going to have effects on the body, right? You're not going to feel as good. So I think it's important because that's what we look for. We look for those little things that don't make us feel as good.
And we're talking about this because legitimately it is like the thing that it's like the place that we start, and it's the thing that we see the most. We've seen people, we've had people come from all over the world to our clinic, and we like look at, and then we ask like, have you like, can we see, like, do you have old blood work, right? And they give it to us and we go right to it. And you can look back on like serial tests of like, of people. And oftentimes it's just been in this like low functional range forever. And I could make a list of like athletes, patients, things like that all of a sudden it's like, you're like, hey, like, how, like, do you have old blood work? Like, this is going on right now. I'm so tired. I don't feel good. I'm not recovering like I used to. Like, I can't keep up. Like, I'm so tired. Is like just something I hear all the time. And then, we go through and we correct this. And then all of a sudden it just looks like magic. Like, they're going through and they're like, all of a sudden their performances are back up, and there are people are just like, they're completely different people. They get their life back. I've even had athletes that were like crushing it. And then it's like, we find some of these things and then all of a sudden they're like going on and like winning like medals at the world championships and the Olympics and things like that by just like a small little like change in that area where it's simple.
It's simple.
Right. Yeah. And that's not to downplay what anybody's going through or anything, but oftentimes like the basics get missed.
The basics get missed a lot, right? And that's actually why blood chemistry is such a beautiful thing. Because when you think about it, it's measurable, right? It's a common language across all practitioners, right? So that's what makes it such a wonderful thing, because you can talk about it amongst different people and everybody understands blood chemistry, right? Maybe not to the level that we need everybody to understand blood chemistry, but it's like easy to converse about like why, right? And when you have that standard, you can measure it, you can make changes, and you can track the progress. And it's like you could see those little tweaks when they're made, and then to see the shift in the body and the symptoms in the person or the performance optimization, it's really powerful.
Yeah. And then it gives you a roadmap of like where to go, right? Because even there's been times when something's going on with somebody and like we run blood chemistry on them and we're like, man, like this actually looks pretty good. Yeah. Right?
It's like you can kind of rule it out, right? You're like, okay, this actually might not be your problem. Because blood chemistry, another wonderful thing about it does test for many different like organ systems, right? Like we can look at the blood, we can look at oxygenation, we can look at kidney function, thyroid function, heart function, blood vessel health, like thyroid health. There's so many things blood can check, but sometimes it might be elsewhere, right? The clue might be elsewhere. It might be in a stool sample that we find the problem, right? Or it might be in a hormone test that we find the problem. So that's why it's important to be an investigator. And I think that's what we kind of specialize in is we investigate, right?
Yeah.
We're kind of investigators of health, I would say.
Yeah. So it's and the blood work it gives you the roadmap to like where to go. It's like, okay, well, we, like in your case, right? Like you had some immune markers and like they were down, right? And where it's like, okay, well, like, where is this coming from? We need to explore more. And then that's where, like, you mentioned stool sample, right? Like a lot of times when we start to see the, like these infection markers, like on the CBC side for the white blood cell versus like the red blood cell, when you start to see some of these immune markers start to get like a little crazy, you're like, okay, well, where's this infection coming from? Is it like, like systemic? Is it in the gut? Is it in the jaw? Is it, is it in like one of these other places that's maybe like you don't know, right? And then you got to start like hunting in there, or like, hey, there's like some of these things going on in like the liver. You're having like some of these other like symptoms going on. Maybe we need to get like a full hormonal profile. Maybe we need to look at like a urinary like toxin test. Maybe we need to look at like hair analysis, stool analysis, saliva, like all these different types of things to start to look at like where are like, it's like, there's so many areas where you can look for things, so it's like the blood work gives you that roadmap to be like, what do we need to check? Do we need to check like urine, saliva, hormones, stool, like, where we kind of look at all these different areas. Yeah. And then that gives us the roadmap of like where we need to go.
Yeah, because the truth is there actually is no perfect test, right?
No.
But every test gives such a wealth of information, right? So they all have their pros, they all have their cons, but it's good to kind of run them in combination also to get the full picture of what's happening inside the body, right?
Yeah.
But they're powerful tools, and we are able, like my philosophy is so simple. It's like fix what you find, right? Especially with complicated health issues when you're kind of like, where do we start? It's like, just start looking through all the labs, find what's off, fix it. And that's where the magic starts to happen, right? Symptoms start going away. People start feeling better. And it's a simple philosophy, but it's powerful and it works.
Yeah. And so I think that's like an important thing is just being an investigator, right? And then, it's like the blood is one thing. And then, there's a lot of symptoms where people often get told like, hey, like when they look at a general blood panel, but they're not analyzing it for health, or maybe they're not looking into some of these other areas, they always get told it's like, oh, well, it's like, it's in your head.
Yeah,
right?
For sure.
And then I always have a joke like with that, where when people are like, oh, it's like, it's in your head. And I'm like, well, if that's the case, then we can look at that too. Right. And then that's where you can look at things like acute EEG.
Oh,
right?
Yeah, for
like
sure.
Where you can start to look at like brainwave and all these things, because one of the other things that we kind of talk about like in our practice is I jokingly call it like the holy trinity of health, right? Like where you look at like the brain, the body, and the blood, right? Like where it's like, because if there's like imbalances in the brain with like brainwave signals or like stress patterns in the brain, which I think is an interesting thing for most people to think, is that actually like stress is quantifiable, and you can actually see stress in the brain, right? And so when we go through and we run a QEEG on somebody to look at what's happening in the brain, we can see areas of stress that are happening in that area, where we can pick out the different areas of the brain where there are these stress patterns. And then we can go in and we can target them, and we can actually use brainwave biofeedback to actually nudge the brain out of that stress response. And so then when the patient is doing some type of a therapy or something like that, they're able to release these stress patterns in there. So it helps everything work better, and it helps calm down the whole stress response in the body. So between that and HRV testing, you can really get good information about what's going on in the brain, and being able to understand those things, because like stress is like the catalyst. So it's like if you have these imbalances in your blood, but then you also have these like stress patterns in your brain, and that communication is like amplifying that. It's really like the magic of being able to like work on the, like identify the imbalances in the brain and find the imbalances in the blood, and be able to like put those two together, and then actually treating the physical body, working on the, because the physical body is also also important too, working on the muscles, working on the ligaments, moving the lymph, like movement and like the muscle activation and like balancing of like the fluids in the body through like movement and like activation and that connection of the brain to the body, like, like to reconnect all those circuits so everything works correctly is also super important. So
For sure. Yeah. It's like you have to kind of look at the stress patterns, right? Because stress, it's so funny because everyone's like, stress causes like all our problems, right? But interestingly enough, it seems so like hard to pinpoint, kind of quantify, but you actually can quantify it, which is something we've been doing in our practice actually recently by using like something called neurofeedback, right?
yeah.
Neurofeedback is actually looking at the different brain waves and kind of seeing how we can modify them or train them to be a little bit different. But it is kind of cool to see certain stress patterns, right? So we can make stress maybe a little bit less of a mystery.
Yeah.
Yeah.
And when we run that, like when we get the information back from like the QEEG, it's actually kind of fun to like talk to like the patient about it because likely like what I'm going to see in that QEEG is the thing that they have been struggling with, like from a like mental perspective, like, it's like I can basically say, hey, do you have this problem? Like,
well, the things like anxiety, like, depression, maybe OCD thoughts, right?
Yeah.
Or just being like so overwhelmed and not being able to manage the small stressors in life, right? There's like little things like, actually, I mean, I'm not gonna say little things, they're big things,
They're huge
right?
things. Yeah.
They can be really debilitating in people. But there is a pattern in the brain that sometimes drives them. And our brains kind of adapt, right? Like, to be honest, at the end of the day, our body's always trying to protect us, right?
For sure.
It's trying to like, things kind of ebb and flow, but we get into a problem when that pattern it's used to protect us doesn't really serve us any longer.
Yeah.
And then it's almost like our body's repeating the same thing over and over again. And that's when we have to like try to shift it, right?
Yeah. And I think that's an important thing for people to remember is it's like a lot of times people will come in and they'll be like, my body's just falling apart. It's failing me. It's doing X. It's doing Y. It's doing Z. But really like what it is actually trying to do is it's trying to protect you and it's trying to keep you in a safe space. And so I think that's the important thing to remember. And so I think also too with some of like the brainwave stuff and like looking at that, it's like your body has developed these like patterns and imbalances. And a lot of people just are like, well, that's just how I'm wired. And kind of technically, yes, because that's how your brainwave is like activating. But the nice thing that I think that people should remember with any of these conditions, because these can drive a lot of chronic health things. It can drive a lot of things like breaking down in performance, that these are all treatable things. Like, it's all things that can be helped. It can be improved. It can be worked on. It takes time.
Yeah.
And I think that's one thing often but usually most things are treatable. And as we start to reduce the stress patterns in the brain, we start to remove the the imbalances in the blood. We start to work on like areas of physical tissue that is imbalanced. Like you can make a lot of progress, but it is important. It does take time.
Yeah, no, absolutely. I really do think it is important to talk about like the amount of time it can take to shift the body. When it comes to blood work, you have to think of it in cell cycles, right? Usually I like to give like a 90-day cell cycle. I mean, our bodies are constantly turning over, are in rebuilding, right? So we like make new tissue, we make new red blood cells, we use them, right? But they also get tired, they get worn out, they need to be broken down, they need to be recycled, right? New ones need to be created. And so sometimes like when we're changing things like anemias or, trying to shift the immune system, you have to look at the cell cycle. So it can take potentially 3 months of giving certain nutrition or pushing certain biochemical pathways to really push the body along and see those changes. And so, we're like not in the business of like giving a pill to cover up a symptom, right? We're trying to get to the root cause of something. And that does involve time, patience, and giving the body time to heal. You give it the nutrition, you give it the raw material, and then you give it the time, and then you see the magic happen.
Yeah, and I
Yeah.
think, it's like, I mean, we talked a lot about anemia because I think it's just so prevalent, like in there. And it's like, I mean, yeah, you've got to make, your bone marrow's got to make new like red blood cells. It's got to produce them. It's got to mature them. It's got to go through this whole process.
Yeah.
And so, I always kind of have a saying that we use. I kind of say like 1 week, 3 weeks, 3 months, right?
Oh.
Is like,
Yeah.
it's like, when people come in with like a complaint, oftentimes they'll see some improvement within like the first like week or two.
Yeah.
Because you're giving them what they need. You're starting to like almost like put the brakes on. And the cool thing with like, doing some of like the brain work and balancing some of that is when that body's in this like chronic like fight or flight stage, like the vagus nerve deals a lot with like regulating inflammation and stuff like that. And so if you can almost put the brakes on and then you can kind of like give them something that helps to move out that acute inflammation, they usually feel better.
Yeah,
like
for sure.
really quick. And sometimes it can be quite profound and quite remarkable.
Yeah, I mean, fast changes can't happen,
Yeah.
right? Like, I mean, that's the thing. Certain things move quick, other things move slower, right?
Yeah.
Like, we talk about cell cycles. Like, for example, like hormones are one of those, they're slow chemical messengers. They can take time to shift. But like you said, sometimes with inflammation, you can put it out pretty quickly and, you could feel the shift quickly. So, we say like, yeah, wait for the cell cycle, but there are wins along the way, right?
Yeah.
It's not like, oh, it takes 3 months to feel better. You're going to feel better like along the way, right? But then we want those like substantial changes that last for long periods of time, that you feel stable and grounded and your health doesn't feel like, something's going to set you off.
You build a better foundation. And so it's like getting rid of that acute inflammation. And then like as, like the next like 3 to 4 weeks go on, you get rid of the chronic inflammation. So some of that chronicity and, as you're getting rid of chronic inflammation, right? Like it's like it's usually an ebb and flow because you're like, oh, I feel better. And then your body's like, cool, well, you feel better. I'm going to release some of this stuff that's been stuck in your tissues for even longer. And then it's like a little thing like dips up and then you're like, okay, like, and you just work through it. But then as you do go through that like cell cycle changes in that first one, you're a little more resilient. And then you go through another 3 months of like getting the right raw materials, continuing to work on your body, continuing to balance everything. And your body like has now more resilience because it's got another layer of like stability. And then it's like, you're just stacking layers on layers on layers on layers. And eventually you have a pretty good foundation that you just, it's harder to like, like rattle that, like when you get exposed to maybe like, you get exposed to a virus, you get exposed to a bacteria, you get, exposed, eat something you don't, a major stressor shows up, right? Like, and your body can just handle it better. And that's kind of, again, what we always want. We don't want people to be like dependent on everything. We want to build, like remove those interferences from the body so the body can continue to be its best expression. And so again, that's why we look at all these labs because we want a wide picture of like everything that could be affecting you, right?
No, for sure. Well, like, I mean, and you may have heard the saying like healing isn't linear, right? Like it's not just this like step up. Like you have some ups, you have some downs, you might have some like loops, but like ultimately, if you're starting down here, we want to get you up here, right? Yeah. And trending in the right direction. And the stronger you get, the more you can hold it.
Yeah. So, I mean, I think that's kind of like an introduction to like how we're kind of looking at things, some examples, and we're going to go into more specific examples on like cases and conditions and things like that. And we're going to bring people in to talk about, like all these things and how we like work on like managing these things and what we're doing. But we just wanted to kind of lay the framework about like how we're looking at it, like what is maybe a little different, things that you may not have known. Yeah. So we can just get a better foundation of kind of what's going on in those areas, because it really is important in the end to really start to have this like foundational knowledge and to understand like that, yeah, there may be something going on. There may be something that you need to address that, that maybe is getting missed. So if you are kind of struggling with something, that you're not able to resolve, there are answers and there are different ways to look at it. And you just gotta cast a wide net and dial it in, because there are things that can be done. And as we always like to say, like in our office all the time, and if people who have spent time in our office, they see it all the time. It's like, we always have like hope for healing, right? Like that's like kind of what we're doing, is we're purveying hope. We get really some of the worst conditions you can think of. And we also get to have a chance to work with some of the people trying to accomplish some of the hardest challenges and the toughest goals. And so with this avenue of looking at these things and how you can kind of dial in and optimize your health and remove all those obstructions and restrictions, we think this is just one of the most powerful things that you can do for yourself is start looking at those interferences in your body so you can be the best version of yourself.
Yeah, absolutely. I think it's all about like getting to the root cause, doing a deep investigation, and there's more there than you think there is, right? If you're somebody who's been told that like everything looks good, I think it's good to get a unique set of eyes on it, to kind of look at the problem differently and to find those little caveats that you can kind of fine tune that can make big changes in the body.
Yep. So until next time, we'll see you around.